Hello, my name is Desiree Armstrong, a student respiratory therapist from Baptist University. And today I'm going to be doing my skill video on extubation. So during the video, I'm going to show you all the supplies you need to gather for extubation and what values from the ventilator and the cardio monitor that you should be monitoring and getting from the patients to make sure that you can extubate the patient. So the first thing you want to do is make sure you have an order for the extubation, and then you want to start gathering your supplies to go and speak to the patient. This is the supplies for intubation. It is needed in this case patient to be intubated after the extubation. First, you have the bed valve mask, the towel for neck placement, stethoscope listen to breath sounds and abdomen sounds, the ET tube with the stylet. You have the laryngoscope and the Mac blade. You have the 10mm syringe, the flow meter. You have the lubrication to lubricate the tube. You have the colorimetric CO2 detector, the cuff feel to measure cuff pressures. You have the ECT tube ties and holder with the tape for securing the ECT tube. And once again, this is all the supplies needed for intubation. Next, you have your entrainment mask setup, which consists of the mask, the tubing, the collecting bag, the flow meter, and it's used to deliver a fixed mild to moderate FiO2 and cold mist that can help with swelling. This is your suction setup, which consists of the vacuum regulator and container with the tubing. Next, you have your gloves and hand hygiene, which should be a minute. Next, you want to assess the patient. So these are some parameters you want to assess of that patient. You want to make sure that hemodynamics stable. Looking at their blood pressure and heart rate. You want to get their respiratory rate and SpO2. Make sure there's not any respiratory distress. Look at the EKG, just to make sure they don't have any dysrhythmias. You want to measure their maximum expiratory pressure, which is basically measuring their respiratory muscles. You want to make sure it's not close to a -20. You want to look at their vital capacity just to make sure it's not decreased. Then you want to look at their ABG to make sure they're in a normal acid-basic balance. You want to make sure that they're not acidosis or alkalosis. And once you have confirmed that the patient is stable, you can proceed with instructing the patient and starting the extubation. Good morning, Mr. James. My name is Desiree Armstrong. I'm a student respiratory therapist from Baptist University. And today your doctor ordered me to take the tube out. So we're going to extubate you. First, I'm going to assess you just to make sure that you are able to successfully be extubated from the ventilator. And then once I have confirmed that you can be extubated, then we're going to teach you the steps of how we're going to extubate. And then we're going to put you on your oxygen mask and monitor you to make sure that everything is going correct. Okay, so first I'm going to just do some vitals on you, get some vitals. Here go these parameters again. Once again, you want to assess these, make sure the patient is stable. Within range. So now we're going to do the cuff leak test. Especially, I'm going to remove the air from around your cuff, just to make sure that you have no swelling in your throat. So basically what I was looking for is either the ventilator to say that the patient is disconnected, which means no swelling, and also if the ventilator doesn't say disconnected, you want to see the exhale tidal volume drop at least 105 milliliters. It's also an indication of a good successful weaning or extubation. So once we have confirmed that the patient has no swelling, okay, so now I'm gonna position him in high filers and also brace the bed up. Okay, I'm just gonna lift you up some more. Okay, now that I confirm there's no swelling. Now we're going to hyperoxygenate the patient and suction the patient. So, push it, hyperoxygenate. Okay, Mr. James, I'm going to suction you. Okay, suction, patient's good. Not getting too much, no secretions really. Now we can lock it. I'm gonna switch it to the yanker so we can suction the mouth after we pull. Now, Mr. James, everything is good. No swelling, not the milk secretions. I think it's time for you to be extubated. We're gonna take the tube out now. So while taking the tube out, I'm gonna need you to take in a deep breath and start forcefully coughing while I pull it out. It's gonna help relax your vocal cords and prevent damage to your vocal cords. However, you're still gonna feel some soreness, throat, and also you might be hoarse, but that's coming due to the tube. Okay, so then we're gonna start loosening up the ties. Got our syringe, okay? I'm gonna deflate the cuff, and then on the count of 3, we're gonna start. Take a deep breath, start coughing. I'm gonna pull the tube, okay? 1, 2, 3, deep breath, cough. Okay, keep coughing, keep coughing. Okay, keep suctioning. You're gonna get the oxygen. Place it on the patient. Okay. And you're gonna still monitor with the cardiac monitor. You're gonna be monitoring the vital signs, respiratory rate, heart rate, blood pressure. You wanna make sure the patient is still hemodynamics stable. Look at the EKG rhythm. Okay. Once the patient has confirmed that they are successfully extubated, you can start cleaning up. You can put the valve and everything in a biohazard bag. Okay, and then you're done. You want to assess the patient parameters again. Make sure they are hemodynamic stable. Once you have confirmed that the patient is stable, you want to now make sure you have lowered the bed, put the patient in semi-Fowler's before you are able to leave the patient room.